We'll take your lead about when it's a good time to begin.
Yes. Waiting for a few more, and then we'll start.
Sounds good.
What time is it there in LA now?
7 o'clock at night.
Okay, good. So we need to.
Not so bad.
Now we have 50, almost 60 participants, 55. I'm meeting you. That's good. Course this morning. Good morning, good afternoon, good evening, and everyone. So I just want to welcome all of you and to the course on systematic reviews and meta-analysis led by Dr. Shelley Pasente and Ms. Duran. So this course is part of the CCC training program, which is funded by USNIH, Poverty International Center. And the goal of the training program is to improve the research capacity on HIV. But for this particular course, we welcome participants who are not working on HIV, but they are interested in doing systematic reviews and meta-analysis. So welcome. And the second I want to say is that I would like to thank Dr. Facente and Ms. Duran for offering this course, and we're very flexible in terms of how we organize it. This course was supposed to be 5 days straight, but given the time difference, so we will just do the first part in 3 mornings, today, tomorrow, and Friday, 3 mornings in Vietnam. And then we'll meet again in early December to review what has been accomplished, and then continue to dig deeper into the methodology, as well as review what you have completed. And then after we will have about 6 months to complete whatever manuscript on systematic review and meta-analysis that you want to conduct from now. So our goal is to have a concrete product. So if anyone expect that they just join in and listen and learn, you could excuse yourself. That's something that's not what we expect. Would like a concrete products by mid 2026. So once you are committed to this first session, please find your partners or colleagues so that we can register for a concrete product at the end of the first session. So by Monday next week, we expect you to register what products that you would produce. So that would be my third comment. And last but not least is that we will do this through Zoom. So please respect the lecturers and the participants. So once you join in, please turn off your microphone. And if you want to speak, please turn on and ask questions or discuss. Okay? So those are some of the few reminders and again, welcome all of you. And big thanks to Dr. Facente and Ms. Duran for doing this. So over to you, Dr. Facente. Thank you.
Excellent. Thank you so much. It's really our pleasure to be here. We're very excited to be able to share this with you. And as Dr. Zhang just said, we have not done it in this format before, where we had part of it done through Zoom. Um, did you just lose visual? Oh, it came back, I hope. Part of it done through Zoom. And oh, you did. Okay, sorry. Hold on one moment. I don't know what just happened, but my screen went blank for a moment. Okay, hopefully that is working again fine. So we'll have to be a little flexible with each other as we try this format and go through it. Before Sara and I introduce ourselves, I wanted to share that the slides from today and then tomorrow and the next day, we will also post the slides on this website. We have a website here where we have resources we'll be referring to, the slides I'm showing you today. All of those things will be available on this website, which I think Sara is going to put in the chat momentarily. And the idea is that you can go there at any time and download the materials that we're talking about and use these slides as reference. Okay, so now we'll just do some quick introductions. So my name is Shelley Facenti. Dr. Zhang pronounced my name very well. It's pretty surprising. Most people in the United States can't say it very well. And I have two main roles here. One is about 15 years ago, I started a company called Facenti Consulting that does a lot of public health consulting work of different kinds. And one of the things we've done is support some people with doing systematic reviews and doing different trainings on similar topics. And I'm also an adjunct professor at the School of Public Health at the University of California, Berkeley, uh, where I teach mostly program planning and some other things like that in the Community Health Sciences Division. And I'll pass it over to Sara for her to introduce herself.
Thanks so much. So my name is Sara. I have master's certification in health education and a master's degree in public health with a concentration in epidemiology and biostatistics from the University of Southern California. I've been with Facenti Consulting for over 4 years now, and I helped to develop this curriculum that we're going to be going through together last year when we were hired to provide this training in South Africa. So I'm very excited to be here with you all today. Thank you.
Before we continue, Shelly, are we recording this session?
You're asking me. I was not, but I certainly can. Let me go ahead and do that.
Recording in progress.
Very good. Wonderful. Okay.
Great. Thank you. Also, Sara sent me a message that the slides were not advancing. We're still getting the hang of what we're doing here. So this is the slide I was trying to show you when I talked about the course website, but I think Sara put it in the chat, and so you can see that. And we'll refer to that at the beginning of each morning, but hopefully you have no problem accessing the information there. Okay, so this is just a quick overview of our planned curriculum. So let's see. Sure. Okay, so today we will be doing an overview of systematic reviews and meta-analyses, just sort of orientation to what we're talking about here. We'll talk about the PRISMA guidelines and registering your systematic review in Prospero, which if you don't know about that, you'll learn about it. And then towards the end of the morning, we'll talk about actually defining your research question and thinking through the population and the sort of eligibility criteria you plan to use for your review, which is often referred to as this with this acronym PICOS. So we'll go through that today. Then you'll have kind of the grounding in how to start thinking about your review so that you can start practicing from there. And then you can see we have different things planned for Thursday and Friday where we'll really get into what happens when you start searching and how do you search for these studies. And then once you have searched, how do you screen for them? How do you extract the data and actually write it up? So all of that is coming. And then we will be coming to Hanoi the first week of December and as Dr. Zhang said, reinforcing a lot of this information and giving you more time, going a little deeper and then giving you more time to practice. Okay. So let's just dive right in. What is a systematic review? The real key is that a systematic review is systematic, right? It's not just a literature review. You've probably all worked on literature reviews. The idea with a systematic review is that you're trying to gather all of the evidence that fits some sort of eligibility criteria that you specified in advance. You said, I want to see all the research that meets these definitions, these criteria, and we'll systematically look at all of the literature in order to address a specific research question that we've set aside. And that research question will be answered by looking at all of the analysis all of the studies that you find. And then in some cases, you'll pool those together. You'll use the data from all those studies and pool them together to get kind of almost like a big sample size. And then you say, across all the studies that have been done, this is what we see about this issue. But that's not always required. What's required is that you're systematic. And the idea is that you're saying in advance, this is what we'll be doing. And then you do exactly that thing. And then when you publish about it, you are very clear about that thing so that someone else can look at that systematic review and say, I want to try that. And then they follow your exact steps and they can come up with the same answers. So it's reproducible because you were systematic, which is very different from, I'll go into Medline or PubMed and I'll look and see what I find and then write up a summary. It's more formal than that. Okay, so that's what we're here to learn how to do. And there's multiple steps to this process, which we'll go through. There's, starting the problem to begin with. What is the problem that you're trying to understand? How do you search the literature? Then how do you screen the literature that you found that you think might be good literature that answers your question? And then once you've screened in only the studies you're sure are eligible, how do you extract the data from those studies? How do you assess the critical appraisal is what it says on this slide. How do you assess the quality of those studies? And then do you do any kind of data analysis, synthesis of the information in those studies, or do you just sort of package up a summary of what you found? Then in step 6, you report it, you disseminate it, and then sometimes you, in the future, do an update or you reanalyze. You see there have been more studies published or something has changed. Let's add to what we did before. And you don't have to start over necessarily, but you're building from what you did in step 7. So you really go through each of these steps very methodically, and that's what we'll do throughout this class.
So this was all based off of work by Archibald Cochrane. He was a physician and epidemiologist from the UK who was the first one to employ this method. It had already gained popularity in the fields of psychology and education, but he was the first to really employ it to healthcare and medicine, primarily to provide further information so physicians would have that information to improve clinical decision making. Over time, this has become an incredibly important tool for researchers, academia, and beyond. In 1993, a nonprofit was established and named after Cochrane. Their mission is to promote evidence-informed health decision-making by producing high-quality, relevant, accessible systematic reviews and other synthesized research evidence. They are known as the Cochrane Collaboration, and they developed trainings and the premier handbook on systematic reviews and meta-analysis. Much of our content in this course is actually based on their work, and so they're a great resource. Systematic reviews should have explicit objectives with predefined eligibility criteria, a method that can be reproduced, a methodical search to identify every available study that meets that eligibility criteria, an evaluation of the validity of findings in the studies, including assessing risk of bias, and an organized synthesis of the included studies. This process is what makes them systematic.
Okay, so now we'll talk about why and how we use systematic reviews. These aren't easy to do. They take a lot of time, they take a lot of effort. So why do we bother? Why do we do this in the first place? Systematic reviews are really used to collect and condense research and information on a topic. And they're used to help inform maybe clinical providers, academic researchers, people making policy, and even sometimes the general public about that topic. So where many of these people, a policymaker in a government organization may not read every study on a topic. They probably won't, but they want to make a decision based on the evidence. And so a systematic review, the people who do the work of the systematic review end up doing that work to collect it and say, here, we gathered all of this, we summarized it, and now we're providing it to you so that you can just read our systematic review and you can know pretty much everything there is to know about what's been done on this topic. That's the idea. So some reasons to conduct a systematic review might be that there are many studies on a topic and they've all been a little bit different. There are some things that found that some interventions work and some that found that they don't work. Some that, found positive effects or negative effects of all sorts of things. And you want to say, okay, but I've heard there's some positive and I've heard there's some negative. If I look at all of the research that's been done, what conclusion can I draw? Can I say, overall, mostly they're positive, but there are a few that are negative? And can I see what's different about the ones that have had a negative effect, for example? So that's one major reason that people will often do a systematic review. Another is to address a clinical question that is really uncertain, unresolved. People are not sure, well, what is the best practice here? Should we be prescribing this certain drug? Should we be performing surgery in cases like this, or should we be waiting? Things like that. Systematic reviews will often be used to say, anybody who's researched this question, who's compared outcomes in this way, what have they found? And can that help us make a decision about what should be the best practice that we follow repeatedly? Another might be exploring differences in clinical practice. So not necessarily that it's uncertain, but that there's some disagreement or difference. Some people say it's much better to do this more invasive surgery, it has better outcomes. And other people say, no, it's much better to do this laparoscopic non-invasive version or something like that. And so you can look, can we compare what we've seen over multiple studies over time, not just a single study, but look at all of the evidence available to us. Another one, which I already sort of explained, is that you can gather evidence that then supports decision making. Maybe that's policymakers or others who want to know what's the best way. If I'm going to make a rule here, if I'm going to make a policy, what's the best evidence to do that? And it summarizes all of that. And it also often, systematic reviews can be used to highlight areas for future research. So you're in some ways scanning all of the literature and then saying, we found all of this information. There's a lot of evidence about this piece of the topic, but then we have this other piece of the topic where we just don't know. Not enough people have done research. We don't know the information. And so we really recommend that more research be done in this area to fill this very notable gap. So a lot of times describing where you found evidence and where you didn't, because there's not enough research done, is one of the most important findings of a systematic review, aside from doing a meta-analysis and saying, well, the pooled result across all of these studies was this thing that was a positive or negative effect. Just to say, this is an area that has not been well studied. We could not find much evidence on that. We need to study it more. That's a really valuable thing to do. So these are all reasons that you, when you're thinking about your own research and what would be useful, where do you think you need, where you will be adding value to the literature by doing a systematic review on the research topic that interests you, these are some of the kind of motivating questions that you may say, that's the reason that I think it's valuable for me to do this systematic review with this research question. So that's why we go through this. The point is really that systematic reviews go beyond the individual study. So each individual study always has some problem. There's always some sort of bias. And, no study is perfect, no matter how. And when you look at a whole bunch of studies, then you end up realizing, okay, well, that one had this bias, and that one had this bias, and that one had this bias, but together they all found the same thing. We actually feel pretty confident that together this is doing what we want. So it kind of lessens the drawbacks or the limitations of individual studies. It's also true, besides the bias, that all studies have random error. Even if the study was perfectly designed and had no bias, which we know doesn't happen in practice, but even if it did, all studies have some kind of random error. So it's always valuable to clump multiple studies that are ideally completed well, because then you're lessening the effect of the random error from any one study. And individual studies often have issues with generalizability, right? They cannot, just because one study happened in one specific population, in one specific place, in one specific time, doesn't mean we can say that's true for the world. But if you have studies that are happening here and there and in this population and in that population, and they all find the same thing, then it's much easier to say, we think this is true everywhere. We have reason to believe that that's true. Okay. Oh, good. Muted. All right. So we'll talk about this much more in depth later, but I just want to touch briefly on what meta-analysis really is. Because this is a course on systematic reviews and meta-analyses. Meta-analysis is when you use statistics to combine the results from two or more separate studies. They're very often part of systematic reviews, although they can be done on their own, and many systematic reviews do not include meta-analyses. A lot of times it's not appropriate, given the studies that you found in your systematic review, the studies that you searched for and screened in and then reviewed. It's not actually appropriate to combine them statistically. Maybe they're not all studying enough of the same thing, or you have concerns about the quality of what they found. And in that case, it's just much more appropriate to describe what you found and leave it at that. But sometimes it does make sense. The goal of your systematic review is to find many studies that are all measuring the same outcome in roughly the same way. And then you use statistics to combine them together. And essentially, it's like creating a bigger sample size. You have this study that used 100 people, and this study with 500 people, and this study with 700 people, and then you combine them together and you have a study for 1,300 people. You have more power to see something. But again, you only want to do that when the underlying studies are similar enough and high quality enough to make that worth doing. But when you do so, as it says here, meta-analyses can improve accuracy. They pool the sample size, so you have more information to look at. They can sometimes provide answers to questions that individual studies don't address, because an individual study is very focused on one thing. But when you combine it across many studies, it may help you kind of look at the bigger picture and see more. And they can also be very useful for developing new hypotheses, deciding when, when you're seeing something different. In an example I gave before, maybe you have certain studies that show a positive effect and certain studies that show a negative effect. And you can say, well, overall, when we combined them, everything was skewed slightly positive. The average was slightly positive, but there really are distinct differences in this pool. And here's our hypothesis about why. The studies that are more positive tend to have a certain characteristic. The studies that are more negative tend to have a different characteristic. We don't know if this is true, but our new hypothesis is that, this intervention is different given these two characteristics. And then you can design a study or recommend that others design a study to actually look at that. So those are all reasons that you might do a meta-analysis, which again, we'll talk about more later. And we've found that in classes like this, some people are very oriented towards statistics. They're very excited about doing a meta-analysis. They think that this is a very important piece. And other people say, this is too confusing, too much, I would never do this. And that's fine. If you work on a systematic review where you think a meta-analysis is useful, then you should partner with a biostatistician or someone who's comfortable with meta-analyses, because they're not simple. The statistics are a little complicated. So we will go over them today, this week, but not in such detail that if you don't have a statistics background, you'll suddenly be able to do it. We'll just be giving you a basic understanding of what's involved. Okay. So, oh, go ahead. I'm going to pass this over to Sara.
I was going to say, I'm not sure if you wanted to answer the question in the chat, which is, in which cases do we decide to apply a systematic review versus meta-analysis? So if you can kind of reiterate when you would actually utilize a meta-analysis before we can move on.
Great. Yes, thank you. And thanks for calling that out. It's a little hard for me to see the chat, so I appreciate it. Yeah, so I would say, let me go back to the meta-analysis slide here. I would say that there are cases where you would use a meta-analysis are a couple. One is when your primary goal let me actually go back to the reasons that you would consider doing your systematic review in the first place. If your primary goal in doing the systematic review is to address, resolve conflicting evidence or address a clinical question by gathering all the information and then to see whether all the different studies are more positive effect or more negative effect, then you're likely more interested in doing a meta-analysis. If what you're looking to do is, right here, you're looking to provide evidence, kind of an overview of all of the evidence on a topic so that a policymaker can just make a decision about what they think based on the summary of all that we know about the topic, maybe a meta-analysis is not as important, because they're not necessarily looking for like a pooled average, a statistical number. They're looking for a description of what's out there in the literature. So that's one thing is, are you primarily interested in learning whether a pooled effect is positive or negative? The second one is the thing that you're looking at an outcome that lends itself to something numerical? Like you're looking at, the survival rates of a particular clinical intervention versus standard of care. That's something that you can each study that you look at would be looking at the same outcome. They would be looking at the survival rates, and they might be in all different populations, but they're all looking at the same intervention versus standard of care. and they're all going to give you a number that you can essentially take an average over many studies and then see across all these studies, are we finding the same thing or not? That's a very numerical, easy thing that lends itself to a meta-analysis. But if you're looking at, questions of the acceptability of certain interventions, or how were those interventions delivered in different environments, and kind of what were the main ways they were delivered? Oh, I don't know what's happening with my screen, but are you still seeing the screen?
It did go.
Oh, nope. Yeah. Okay, hold on one moment. It's just flashing black and then coming back, which I've never had happen before. Okay, I think it's back. Yes? Okay.
Yeah.
So in those cases where you're looking at a question that's not particularly numerical, then you probably would not use a meta-analysis because there's nothing to average. You're just looking to kind of describe in general what people found in their review. So that's kind of how I would summarize it. I hope that answers the question, but if not, feel free to ask for more clarification. We'll also talk about this more for sure when we go over systematic reviews in more detail later on Wednesday. Okay. Now I will go back to Sara.
So when conducting a systematic review and meta-analysis, it's essential to understand the role of critical appraisal. So critical appraisal means carefully evaluating the quality of published research. So looking closely at how studies were designed, conducted, and reported. This includes assessing the risk of bias in each trial, that can help to determine how much confidence we can place in the results. So by systematically reviewing and critiquing the available evidence, SRMAs synthesize our understanding from individual studies, combining their findings in a structured way. So this process increases the overall statistical power and helps identify clearer trends or effects that may not be visible in smaller isolated studies. So as such, systematic reviews and meta-analyses transform individual pieces of evidence into a stronger, more reliable foundation for clinical and policy decision making.
Great. Sorry, was that a question or just okay, accidentally unmuted? No problem. Okay. All right, great. So that's sort of our overview for you all. Now we'll move into the section where we talk about Prisma and Prospero. Basically, what are the guidelines about how to do quality systematic reviews and report them in a clear way. So, sorry, I just want to make sure I can see. Give me one moment. Okay, great. So systematic reviews are really important in healthcare, in public health. They're often used for creating clinical practice guidelines. The World Health Organization or others use systematic reviews regularly before guidelines go out. And the idea is that people see them as shortcuts to understanding the literature. So instead of reading everything that's out there, people trust that someone who did a systematic review read everything that was out there and then is reporting that information in a way that is clear and high quality so that they can trust that and say, great, I don't need to read all of that. I'll just read this systematic review. My guess is that many of you have done something like that in your own research where you were trying to learn about a topic and then you came across a systematic review and you thought, oh, perfect. I don't have to read 100 articles because this review summarized all 100 articles. I can trust that. The problem is that studies have been conducted on the quality of systematic reviews, and a lot of those early studies found that actually a lot of them, maybe the reviews themselves are good quality, but the way that they're reported is poor quality. And if they're not reported well in the literature and it's not clear what was done or what the limitations were of the review, then it becomes very difficult for people to trust whether or not they actually need to read those 100 studies, or can they just say, well, I don't need to because I trust this. So as a result, this group called the Quality of Reporting of Meta-Analyses, Quorum, they created a quorum statement way back in 1999 as a guidance document for doing these types of systematic reviews. And so this conference was convened to talk about this issue. And the quorum group was 30 clinical epidemiologists, clinicians, statisticians, researchers, and also editors of journals. And in this conference, the group was asked to identify what did they think was most important to be included in a checklist of the standards of what makes a high quality reporting of a systematic review. And the idea was that these checklist items should be guided by research evidence that basically says if you don't adhere to the item in this checklist, it might lead to biased results in your review, or it might lead to people misinterpreting your review. And so they used a modified Delphi technique where they surveyed everyone there, they assessed the candidate items, they worked together towards some consensus, and they developed this statement, the quorum statement, in 1999 with this list of items on the checklist. So this is an example of the publication in the Lancet. And Sara is going to put the link to this in the chat should you want to look more closely. But basically, these authors, on behalf of the folks, the researchers at the Quorum Conference, published this article about the statement of how to improve the quality of reporting of in this case, it was very narrowly defined as meta-analyses of randomized controlled trials, specifically. Not every systematic review, but when someone is doing a meta-analysis, they're pooling that data across many randomized controlled trials. How do they need to report that? What's the checklist of items to report that with high quality? So that's this article. Oh, sorry, hold on. Okay. But then in 2009, so 10 years later, this was updated and it was actually renamed to Prisma. And it was published at that time in multiple journals, and it was accompanied by an explanation and an elaboration paper. So all these journals, PLOS Medicine, British Medical Journal, Annals of Internal Medicine, Journal of Clinical Epidemiology, etc., all of these here, all published simultaneously the same paper that talked about the Prisma statement and the Prisma checklist and what should be included according to the Prisma. Oh my goodness, hold on. It'll come back in one moment. Just making sure.
The government shut down.
Yes, sorry, putting it back.
Okay, don't worry.
Okay. All right, great. And then that statement was updated one more time in 2020. So the most recent time it was updated was in 2020. And that was to integrate updates in methodology and terminology. And it was published in early 2021. And you can see, again, it was published in all of these journals. So the Prisma statement is very similar to the consort statement, which you might be familiar with if you work on clinical trials, where there's this expectation that you'll follow consort guidelines, you'll adhere to the consort statement and the checklist that comes with it. The Prisma statement is the systematic review version of that. There are all different other examples. The Strobe statement for observational studies in epidemiology. There's the moose statement, the starred statement, the spirit statement. Now it's a very common thing that all different types of studies, there have been groups of researchers who came together and created their version of this kind of thing. But for systematic reviews, it's called Prisma. So we have the Prisma guidelines. And we have an exercise here that we won't have time to do during this morning exercise, but we will look at in more depth when we're in Hanoi in December, because this is actually important. It's important to know about it before you start, so that as you're thinking through what you're doing, you can make sure that you're setting everything up properly. But it's especially important when you're ready to write up your article, summarizing your systematic review, and publish it, submit it to a journal for publication. Most journals will ask that you submit this Prisma checklist that you see here on the screen. And so on the course website that we put in the chat at the beginning that we shared, on that website is actually the full checklist, which you can download and you can look at yourself and make sure that you understand. It's intended mainly for systematic reviews of health interventions. So I imagine that that applies to probably everyone on this call here. But obviously other disciplines, people who work in hard sciences or other things might do systematic reviews. They may use something similar, but the Prisma guidelines are really meant specifically for health interventions. And the idea is that there's this checklist with many steps. And when you fill out the checklist, you actually say, in my article on page 3 or on page 4, this is where this appears. So it's a whole checklist of things you are supposed to include in your article when you write up what you did. You're giving the full search strategies for all databases. You're specifying the methods you use to extract the data. You're describing any methods you use to tabulate or visually display the results. You're giving all of those details, even if it's in an appendix. And in the Prisma guidelines, you go through and you say, here's exactly where I did this. And most journals will not accept your article if you didn't provide this checklist that says exactly where all these pieces are. And people who are peer reviewing your article typically will look at this. They'll look at the guidelines. They'll verify that, in fact, in the checklist where you said things were, that they actually appear and that you have adhered to the guidelines when you wrote it up. So we're sharing it now so that you can look at it on your own, become familiar with it. But again, in December, we'll go into it more in depth and give you a chance to practice it a little bit and make sure that you feel really comfortable with it. Okay. The next major topic is the Prospero registration, and I'll pass that over to Sara to talk about that.
Yeah, thank you. So Prospero was founded in 2014 with the aim of providing a comprehensive listing of systematic reviews with health outcomes registered at inception. So systematic reviews should be prospectively registered, so before beginning the actual review, to ensure transparency, reduce possible duplication of efforts, and address publication bias. This is because it records all systematic reviews regardless of eventual publication. Registration in Prospero has 27 mandatory and 14 optional fields. We supply the list of mandatory and optional fields in just a few slides, so don't worry about that just yet. It is important to know and prepare for the registration requirements, as most people really underestimate the time that's required for this stage of the systematic review. In order to register, the full protocol needs to be ready. As mentioned before, this step must be completed prior to the beginning of data extraction. And the form must be complete and in English. However, The uploaded search strategies and full protocols can be in any language. So let's talk about how you actually register with Prospero. When you go to the Prospero website, you're going to see two options. To search for other reviews that are already registered, you might decide to do this, for example, to see if your planned review has already been done or is in process. And then the second option is to register your review. This is on the bottom left. So you would click that button to register your review. Once you click that, it brings you to a screen with 5 steps to follow. So step number 1 is to check the inclusion criteria to make sure that your review is eligible for inclusion in Prospero. Step number 2 is to ensure that your review protocol is in its somewhat final form. Doesn't mean that you can't go back and adjust, but you want to be as close to final as possible, and that no major changes are going to happen or are anticipated at this stage. So if your protocol is going to be peer reviewed, it's usually pretty smart to do that prior to getting to this stage. So you want to wait and ensure that your protocol is pretty settled. Step 3 is to search Prospero to ensure that your review hasn't already been registered by another member of your team. Step 4 is to search Prospero to ensure that you are not unnecessarily duplicating a review that is being done by another team or that has been registered previously. And then lastly, at step 5, you will start registering your review. So once you're ready, you would click on that purple button. That brings you to a web form that looks just like this, and you can click on the little circles that have an eye in it. That includes information about each individual piece, but for the most part, it's pretty self-explanatory. You go through and fill out all of the details for the form. However, be aware it is a lot of details. I know this is really small on the slide, but this is the list of all of the fields on the Prospero form, showing you which things are optional. Those are those 14 things that we said were optional, and which fields are mandatory or they're required. And as you can see, there are 27 of those required items. This slide is here for your reference. You can download these slides from the course website, as mentioned before, and then you can have this list ready for when you're ready to register. You'll want to use the reference list and compile all of the answers to all of these items before you start registering. And you register before you actually start extracting any data. And ideally, even before you start formally screening studies. So you'll want to prepare in advance. It's all about planning up front and then following your plan. As was said earlier, that's what really makes it systematic and reproducible, is that you have a very structured plan and then you follow that plan all the way through.
Great.
And then, Shelley, there is a question in the chat that I missed before. Do you have to follow every item strictly with the PRISMA guidelines, I believe, or is there a certain percentage of missing items that are acceptable for reviewers?
Yes, that's a great question, and good timing that's when my computer decided to drop the screen. I would say in general, the expectation is that you will follow all of them in some way. So, this is, I think, let me go back. I know you're not seeing the entire checklist, but I think this question was related to the PRISMA checklist. And so the expectation is that Said that you wrote something. Yes.
And
Now, whether you have done 100% exactly what's asked for in this particular item in this row, there would be varying quality, and I think reviewers would have varying expectations. Some reviewers might be very strict about this. They would believe this is the most important thing. They don't want to be soft on any of these, and so they will give you feedback. You missed item 11. It was not done exactly as you're supposed to do it. That's possible. Other reviewers, I suspect, would say, yeah, they mostly did that. That's close. It's close enough. I'll move on. And so the short answer to your question is it's expected that you do all of them and that you don't miss, because all of them is how you have good quality reporting. But the detail to which you do all of them might be a bit variable depending on your situation. All right.
can I have you answer another question around
Sure.
Prospero versus OSF? So can you compare Prospero and OSF for systematic review registration? Would you recommend one over the other? And they just commenting that they heard that the waiting time for approval on Prospero is really long.
Oh, that's very interesting. You know, I would like to make a note of that and do a little bit more homework and then come back to you tomorrow with a better answer. I think I have mostly only used Prospero and mostly only seen when I have been submitting articles myself, requests for whether there was pre-registration in Prospero, but it's very possible that that's a very US centric registration, and that OSF is much more common in other countries and with other journals that aren't US based. And I hadn't heard that. I have not submitted anything very recently. I hadn't heard that about the Prospero wait time, or experienced that it was very long myself in the past, but it's certainly possible that that's changed, and I can see that that would be challenging. So let me look into that and come back to you tomorrow with some more information.
Thank you.
Great. Yeah, keep the questions coming. This is good. Okay. Our next, oh, wait, we did all this, sorry. Our next section is about starting to formulate the problem for the systematic review, but I'm wondering if you think it seems like a good time to take a break for just a few minutes, give people a break. We've been going almost an hour, and I know it can be a long time to stare at a screen and listen to lectures. Dr. Zhang, what do you think?
Actually, you control the process. So uh, uh, when and how long, up to you. Thank you.
Why don't we take a 10-minute break and come back at 5 minutes after the hour, and then we'll dive into the problem, defining the review question. All right.
Thank you.
So we'll see you all at what time? What time would it be? It's 9. It would it be 10:05?
Yeah, it needs to be 10:05
Okay.
for us.
Okay, perfect. Okay. Well, I'll stop sharing for now, and we'll come back in 10 minutes.
Có người ta cũng bán mà, đấy là bán hết mà.
Thanks, everyone.
Không, ở trên đường Cầu Giấy này có cái làng vòng á. Thơm, có vòng vào. Phố là vòng ở gần đây thơm. Còn đâu nếu mà không ra lờ vòng, vừa mất. Gần đây nó chạy hết. Chỗ gần chỗ mình có gần Cầu Giấy này, đường Cầu Giấy có cuốn làng vòng ấy. Còn không đấy phải nó vừa tối á, không không già quá mà không non quá. Để nó để nó trong cái nhà với lúc gì nó dẫn lại thấy mình thằng giỏi gì ngoài giỏi ăn. Thế là có một cái là rất sao phải đi làm nghề gì đấy. Không vậy. Em bệnh kia bỏ họ đi làm đầu bếp, đi học làm đầu bếp, vừa có bằng dinh dưỡng này vừa có bằng đầu bếp. Lại có đám cháy gì vậy? Mẹ hết đỏ lại chạy này. Video hoa hậu.
Is going to share the slides now, so you shouldn't have any more drops. Hopefully it's more clear now. All right. Okay, so now we're going to start talking about defining that review question. What is it that you want to actually learn from your systematic review? Too often people just sort of jump in and they say, I want to do a systematic review on HIV testing in pregnant women, or I want to do a systematic review about PrEP. Well, you usually need to narrow in and say, okay, what is my motivation? What is my rationale for doing this in the first place? Why am I doing it? And what's the actual question that I would like to answer by doing this review? And that's something that sounds very obvious and easy, but in practice, a lot of people skip that step. And it's really important before you actually start a review. Systematic reviews are a lot of work. You do not want to start a review until you're sure that what you're doing has not already been done or there isn't a team already working on it. And this is why Sara just mentioned that you can look in Prospero to see if someone has already registered a review. A search of Google Scholar or look at PubMed, the Cochrane reviews. Sara already mentioned Cochrane. There might be other sources where you know that it's relevant to your topic. You want to look at it. And so essentially it's like a Google in-depth. You're not writing a whole protocol and doing okay, to exist or not. And you want the not quite answering your research question. It's not quite what you're interested in. And it helps you define for yourself. What I want to do is different. My research question is different than what's been done before. And that's good. And then even if you don't find something that's already been done, like I said, you also want to say, is there someone else already working on this? Maybe they've got a 1 or 2 month head start. And when you're just finally finishing your work, they're going to publish it. And then no one will want to publish yours. You wasted all that time. So before you start, it's good to search Prospero, go in and say, is anybody else registered this? Is anyone else doing this? And if not, you know that it's good for you to move ahead and do it. So that's a really important place to start. And then when you think, okay, I'm pretty sure no one else has done this. I'm really interested in us doing it. Then it's time to really take the time in detail to define the review question. So what does that mean? It means selecting a topic, right? That's probably the easy part. You already know what you're interested in. You know roughly what you want to study. That's your topic. Then you develop a specific question which can be answered. So you're looking for a question that you can actually answer through looking at what's in the literature. And just like if you were designing a randomized control trial, you were designing a research study to be funded, you would have a research question that you're trying to answer. You do the same thing with a systematic review. So what is that research question? Then you set the scope. This is that PICOs that we talked about, and I'll go through in my next slide. So we'll talk about what those are. You set the scope, then you actually create eligibility criteria. What are the types of studies we will include versus studies we will exclude as not being part of our review? And then you write the protocol. You write that detail where you say, okay, here's exactly what we're looking at. Here's what we will include in the review, and here's what we will exclude from the review. You write all those details. All of this happens before you register what you're doing in Prospero. You have to decide the answers to these things before you go into Prospero to answer all those questions on the slide that Sara showed. I saw there was a question in the chat, so let me just see what it says quickly. Yeah, I think so. The question in the chat is if there's a similar systematic review that was done, but it was a while ago, is that a good reason to do another one and update the literature? I think the answer is probably yes. And it depends on, and the second part of the question in the chat is if yes, how long do you think it would be reasonable to do an updated one? And I would say that depends on your topic and how much it changes. So if you are looking at people's perceptions and use of COVID vaccination, and you want to look at all the studies that looked at that, that's changing very quickly. Something that was done 2 years ago might be out of date, or something that was done in 2020 is probably very different from the situation in 2025. I'm not sure if that's the best example, but I think you get the point. Whereas if there's some sort of very stable, well-accepted intervention that's been offered for a long time and hasn't really changed, you essentially want to ask yourself, is what I find in the literature from 2010 or 2015, is that different enough from what I expect I would find in the literature now? Am I adding something so different if I include whatever's new? And you can do two things. One is you can, if the answer is yes, you can say, I'm taking this systematic review that was done 10 years ago, and my task is to update it. So all I'm doing is looking for studies since the time that was published. And then what I'm publishing is an update to that. I'm publishing on all the new articles and how they are different from what was included before, period. Sort of much simpler. Or you might say, the whole game has changed since the time that review was done. Or we think there was a real flaw in the way that review was done. We think that they looked at only a certain subset of things that weren't as important or as relevant. So even though it was done before, we're doing it again. And we're doing it with this new protocol in this new way that we think is better. And so we're starting essentially from the beginning, and you can do the whole thing. That's a lot more work, but maybe you think that that's the right thing to do. So there's no official answer, like 10 years is when they should all be updated. It really depends on your topic and whether you think it seems outdated or not. And then I see there's a question around geographic location. So is there value in localizing the review to a more specific subregion? There absolutely might be. So maybe there's a review that was done in sub-Saharan Africa, and you're interested in relocating that to Asia Pacific region. You certainly could do that. A lot of people would do that. Or maybe the review was kind of all over the place. It was in countries all over the world, and it included 100 different studies, but only 3 of them were from Asia. But since it was done, you think actually there's another 15 or 20 studies done in this region, and we're most interested in this region. So we're going to focus just on this region. And a few of the studies were in that prior review, but you're defining the review question differently. You're setting the scope differently. And so it makes sense for you to start again and do it in a different way. Great. Let's see. Let me just look at this last question. What characteristics of differentiation should we look for to determine if a more specific or updated literature is worth the work? I mean, I would say, and this answer, if you're not already familiar with some of the content we're teaching about in this course, my answer may make more sense by Friday. But I would say a lot of it is about the quantity and the quality of the studies that were included before, more than the time. So again, if your topic is something that's very rapidly changing, then how long those studies have been matters a lot. But if it's not something that's changed a lot, then it's really a question of, do I feel convinced by what I see in the literature, in that old study, right? In that old review? Do I feel like they're telling the whole story from what I can see now in the literature? Or has some major thing changed? There been some major development? Clinical thinking on this issue has shifted. There's been some invention or some scientific advance that makes us think differently, that would change the way these things were handled. Whenever something like that has happened, it makes a lot of sense to do a more specific or updated literature, or if the population is very different. So when we go through these PICO criteria in a moment, if you feel like, all the literature is about people who use drugs and gay men, and you're particularly interested in pregnant cisgender women, and that's what you want to study, but there's only just a few articles in the past about that, but now there are many more, that's a great time to do a new systematic review. So you're essentially just asking yourself, do I think the state of the literature has changed enough that it warrants my time because it's a lot of time. You don't want to do it just because. So hopefully that helps. And I think that this will become more clear as we keep going through. Okay. Oh, I forgot I'm not advancing the slides anymore. It's easier. Okay, so let's talk about what this PICO means, or PICOs sometimes. There's an S that some people use and some people don't. So the first letter is P, and this stands for patient or population or problem, depending on who you ask. So it's essentially like, what is the condition or the specific characteristics of the subgroup of people that you're interested in? That's what you're looking at. So this is where you would define, men who have sex with men living with HIV, or women of childbearing age in Vietnam, that kind of thing. So I would love for you all to put in the chat, and make sure everybody put in the chat, what are some examples you can think of that are how you would define the patient or the population or the specific problem that you're looking at when it comes to a systematic review. It might be the population you're thinking of for your own review that you might work on for this class. Go ahead and put that in the chat. Great. So Leanne, I see you put intervention to prevent violence among transgender women. So the P of that is specifically transgender women. They're the population. The other things you wrote in there relate to the other letters in PICO. So you'll see what I mean in a minute. But you're right. The P is transgender women. So this is like, who are you interested in that intervention for? And you might define it more broadly. You might say like all women of childbearing age in Vietnam, or all in Asia, right? Or you might be much more narrow. You might say transgender women overall anywhere in the world, or you might say transgender women in Asia, or you might say transgender women in Vietnam. Great. So the next one that's in there, exactly. So this would be, so the P, the population, would be people who use drugs who are at risk of HIV. That's the P in the example just put in the chat. Hold on to those other pieces because we'll use those in a minute. But the P is people who use drugs at risk of HIV. Exactly. Great example. I'll wait for one or two more. Okay, great. So the one that was just put in the chat, this again, the population itself would be people living in Asian regions. We can use these examples you're putting in next time because you'll see that the interventions are in here as well. Okay, so we'll go to the next one, and you can continue putting your ideas in the chat as we go. Okay, so the I of PICO is the intervention. So this is specifically the intervention that you're looking at. What are the specifics of your intervention? So some of the examples I see in here are integrated care models of substance use disorders and HIV care, or well, the one around climate change. In this case, you may not have a very clear intervention. The exposure would be climate change. So I guess that's what you would use as your intervention. It seems odd to characterize climate change as an intervention. None of us are trying to intervene with climate change unless we're trying to stop it, I think. But the exposure that you're looking at is specifically climate change. The example up above from Leanne is, interventions that are designed to prevent violence among transgender women, right? That's the intervention, is violence prevention interventions. So these are the I. Does anyone have any other examples of an I that you might use? I's could be as simple as like, I want to look at HIV PrEP, right? You don't need the whole picture. When you're just talking about the I want to look at PrEP as an intervention, or free reproductive care. the intervention is that people are able to access free reproductive care. Now the P, you would define which people are you interested in, but the I is the intervention is the free reproductive care. Hopefully this is starting to make sense. All right, then we'll go to the C. So the C is the comparison or the control. So what is the comparison for the intervention? So it might just be standard of care, whatever the standard of care is, if you think that that's consistent. So it's very clear, everyone's using the same standard of care that's well accepted. So you're looking at your intervention and you're comparing it to standard of care. Or maybe you need to specify what the standard of care is. So maybe it's sometimes it's a completely different intervention. So maybe you're looking at PrEP as your intervention, and then your comparison group is condom distribution. So it's not exactly standard of care, but it's some sort of comparison. And then all the studies that you're looking at in your systematic review would be those that are comparing your intervention to this comparison group. And so when you're thinking through your review question, you want to think through, what is that comparison? Is there a very specific comparison I want, or am I interested in any kind of comparison? Which might make it difficult to do a meta-analysis, right? Because if people are calculating an effect estimate, even if they're all looking at the same intervention, if they're comparing it to all different things, then it's difficult to pool those in any reasonable way and say this is the average effect of the intervention, because you're not comparing it to the same comparison group. Hopefully that makes sense. So before we move on, for the people who put their ideas in the chat, or for anyone else who didn't put ideas in there yet, can you think of any comparison groups that might make sense? If these are the interventions that you're looking at, what might the comparison be? Go ahead and put that in the chat. Sometimes comparison groups might be no intervention, right? Maybe that is the standard of care. Like, for example, the one in here that says intervention to prevent violence against transgender women. Maybe that's the intervention you're looking at, and the comparison is no intervention. It's just there's nothing being done, and we see the outcome. In effect, that is standard of care, but we wouldn't call it that way, right? It's just that there is no intervention as an alternative. So depending on your research question, sometimes there's a very clear comparison intervention, and sometimes there isn't, and that's fine. But you just want to know, you want to be very intentional. In my review, these are the interventions I'm including. This is what I'm interested in. And these are the comparison groups I'm including, or any comparison group goes, I'm not that worried about it. Whatever it is, you just want to be thoughtful about it. Okay. Then there's O. This is one you will always have in a systematic review, and that is the outcomes. What is it that you're measuring that you're interested in? How will you know whether the intervention that you're studying is having an effect of some kind? What is the outcome that you're looking at? And so sometimes these are very numeric, and sometimes they're not. And that might be the thing that determines whether you do a systematic review or not. Whether you do a meta-analysis or not. But either are fine for a systematic review. I see the question in the chat, can we do comparison between groups with different characteristics who receive the same interventions? And I would say, yes, you definitely can, but you want them to have enough similarity. So you would want the same interventions, maybe the same outcomes are being measured, but the groups themselves are different. And then if you're doing that in your systematic review, you will likely, when you draw up your report, you'll want to kind of group those groups of different characteristics. You'll want to say explicitly, like, did you find the same effect of the outcome of the intervention on the outcome across all these groups despite their different characteristics? That would be a very important finding. Or did you find differences? Very often you'll see in the results, which are often shown in a forest plot, which we'll talk about later if you don't know what that is, but it's sort of a graph or a chart that shows your results. You'll actually see it broken down by groups. Sometimes it's broken down by geographic area. So North America, Africa, Europe, Asia, or you'll see it by population. Whatever it is, you'll see by age group or something like that, and then show the effects of all the studies for that population with those characteristics kind of grouped together, and then separately grouping another, and you're sort of stratifying in that way. It just depends what you find and how you write about it. So yes, you can definitely do that. And there, I didn't even see the next question, or the next comment in the chat. But yes, you definitely, that's what I was just saying. If you're including all types of comparison groups, that's great, but just make sure that you are describing and comparing them as part of your analysis. If you have all sorts of groups that are very, very different, and when you do your analysis and you write it up in your report, you don't talk about the fact that they're very different and try to explain what differences or similarities you see across those many groups, reviewers will likely say, I don't really feel like this is very clear. I want to know why they made that choice to include all those groups and what we're learning by having included all of those populations. So it's part of your responsibility in defining the review question to think about what things am I including or excluding and why? And if I'm including all these different groups, then what will I do with that information? How will I report that in a way that teaches people something about this topic? Okay, so that. Go
I just
ahead.
want to emphasize this. Issues are very important. So this is what we are talking about here is a systematic review, not the type of reviews. Although it could be systematic, but it doesn't meet the requirement, especially the PICO question, right? So if you think about doing review everything under the sun about some topics, that's not systematic review that we are referring to. And that could be more understood as a scoping review. Right? So I think the question is very important. The PICO question is very important. Usually we want to know the intervention and the comparison, which is the no intervention or other type of intervention. Right? And rarely we do the systematic review on same intervention but different population. That rarely. It could be done, but it rarely. Usually, we are more interested in comparing different type of intervention. Thank you.
Yeah, thank you. It's definitely important to be clear. Go ahead, more.
Yeah, so by the end of Friday, if you are still not clear on your PICO question, you may not be the best candidate for the next training in December. Thank you.
I'm hoping that we have a little time today before Sara and I leave to go to sleep for you to start thinking about this a bit in your groups. I'm hoping. Okay. The one other letter that I mentioned that sometimes is included and sometimes is not is the S. And this is for study design. So this is an addition to PICO that can be important to be more specific about your search. So maybe you only want to look at studies on your topic that are part of randomized control trials. You want to do a meta-analysis and pool the results across multiple randomized control trials. And if someone did an observational study or something else, you won't include that in your review. That doesn't mean it's not important. It means when you're screening through all of the studies that come back in your search, you're only interested in randomized control trials. or you're only interested in cohort studies or something like that. So you don't always have to include a study design, but many times it's good to do that, especially if you're doing a meta-analysis where you plan to combine them, or if your topic is pretty broad, that your search is returning a lot of results, you may say, okay, there are too many studies on this topic for us to include in a systematic review reasonably. That's why we want to narrow it and only look at a certain type of study. So that would be why you include the S. Okay, so this next slide shows all of them together. And again, you can download the slides from the course website so that you can have this as a reference for you when you work on this. So all of these questions plus the S for the study design, if you want to include that, are really important to be very systematic, very thoughtful. What is it that you are specifically interested in? And then you can see here, you use this to develop your research question. So in the example on this slide, because of the PICO that were designed, your population is specifically women who've experienced domestic violence. That's the only studies you want to include in your review are studies that focused on women who have experienced domestic violence. You only want to look at advocacy programs as the intervention. The comparison is just general practice, routine treatment, sort of standard of care, not having this type of intervention. And the outcome you're looking at is quality of life measured by this specific scale. You can see that that's very specific. You're not going to have thousands of studies probably that meet those definitions, but you only want to include studies that are included that are about advocacy programs for women who've experienced domestic violence, where they looked at quality of life measured by the specific scale. And you can see the research question that's written there. It essentially writes itself. The question is, for women who have experienced domestic violence, how effective are advocacy programs as compared with routine general practice treatment for improving women's quality of life as measured by the SF36 scale? Once you have figured out your PICO, your research question is very clear, but it's very specific. You're not just saying, I'm going to do a systematic review to see about domestic violence interventions and see what's out there, right? As Dr. Zhang was saying, that's more of a scoping review. That's something else. With a systematic review, you're asking a very specific research question according to these PICO characteristics that you have spelled out in detail. And so you want to do this right from the beginning, even before you get to the place where you write your search protocol and you register it in Prospero and you get started. This is number one. And you can see from this slide, the objective of your study and the title of your study end up being pretty easy to write to once you have a clear research question. Okay, sorry, false alarm. Thanks, Sada. Okay, so the one other piece that we wanted to go ahead and talk about before we get into a little bit of practice is when you're determining selection criteria, you're deciding what to include or not include in your review, there are varying degrees of difficulty that come into play. So the answers to some of the questions you see on the screen could make your search much more rigorous, much more specific, or vice versa. It could sort of soften it, make it more inclusive, less specific. You can decide, but you should decide up front. And you may want to play around before you make it official. You want to actually look a little bit in the literature, do your own kind of light scoping review and see, are there a lot of studies all over do I return hundreds of studies and therefore the study type or design that I want to include is just just randomized control trials? That's all I'm interested in? Or do you want to, or you say, well, there are only, according to the rest of my PICO, there are really only 20 studies that I found, period. So I don't want to limit it because then I'll only have 2 or 3 studies that were randomized control trials. I want to look at all the studies, for example. Or what date range will you include? Are you only looking at studies in the last 10 years? Or do you want to look at studies over time? That again could really differ based on your topic. Some topics have changed a lot over time. Some topics haven't. And so you could look at something for the last 20 or 30 years and they're still useful. If you're looking at something like HIV, a lot of HIV interventions, 20 years ago, we were doing very different things when it came to HIV intervention. So you might not want studies from 20 years ago. You might only want them from the last 5 or 10 years, right? If you're looking at something like COVID, similar, you obviously you won't look at studies before 2020, or maybe, 2020, but maybe, 2020 and even the beginning of 2021, before vaccines were available, that was a very different time. Do you want studies from those early months included, or are you only interested in studies from 2022, 2023 or later? Those are the types of questions only you can answer, but you want to talk with your team and make those decisions. What languages will be included? You'll often see people restrict the languages to the languages they speak. Maybe they only, in the US, you often see people say, well, we're only including English language, or we're only including English and Spanish language, and everything else gets disregarded. Is that the best scientific choice? Is there actually a lot of literature in other languages that's very relevant? If so, you probably want to, use a translation service, find someone who can read those other articles and extract the data for you so that you can write it up. So you have to decide how many languages you want to include, and will you have a restriction? Are you only going to look at things that are indexed on Medline or, findable in PubMed? Or do you have local regional journals or databases that maybe people in other places in the world might not know about or access, but you know that it has a lot of information very relevant to your topic? You also have to make a decision about whether you will contact authors for data. So sometimes you will find an article when you're searching, and you'll even find the full text, and they'll say they studied your outcome, but then they don't provide enough detail in their article for you to extract what you need to include them in a meta-analysis. So you have to decide when that happens, will you discard those articles altogether and say, well, we couldn't find the information we needed from the report, so those were excluded? Or will you contact the authors and try to get data from them and say, we need it, but we need it in this format. You didn't provide this detail. We don't have the denominator, something like that. And then you'll include them if they send them. That sometimes happens. It's very common for authors to say, this is too big of a task, for people doing a systematic review to say, this is too big of a task. I'm not contacting anybody. If they didn't put it in the report, we're not including it. But you have to decide, do you think you'll be missing something very important if you do that? And then the last one is about gray literature. Will you only include peer-reviewed articles that are published in peer-reviewed journals? Will you include articles that are preprints but have not been peer-reviewed? Will you include reports or things on websites, things that people published somewhere that are not in peer-reviewed journals at all? What is the rigor that you'll include, and where will you look for articles? And again, none of these are right or wrong, but you have to decide, and you have to be clear about that, and sort of you explain that choice when you write it up. Okay. Before we get into a little practice exercise, I just want to see whether there are any more questions. We went through a lot of material in the last hour and a half or so. If I included Vietnamese papers and English papers in my systematic reviews, will that allow for publication in an international journal? Yeah, I'm not sure if the question is as opposed to including all languages, like if you narrowed just to those languages. I think it's still very common to see that, and that is still possible to include in an international journal, as long as it makes sense. Is it scientifically defensible? Is the topic that you're looking at one where only including Vietnamese and English language is probably sufficient for you to catch most of the relevant studies? Probably fine. Are there a lot of articles in other languages that you're just saying, well, I don't know what they say, and you're ignoring them? Or did you not really come across many anyway, and they're basically all Vietnamese or English, and then you feel confident that you're getting the full picture? Then I think that's perfectly fine. Yes. Let me tackle the question here about access to databases and frankly, the articles themselves, perhaps once you access, even if you can access the search, can you access the article? I think this is very challenging, and we actually have a couple slides, I think, tomorrow talking about this issue, particularly when it comes to the accessing the full text articles. Like, are there some workarounds or creative ways you can access full text articles? There are a few, but this is a real problem, right? This is a problem with the way journal access and access to this, even these kinds of databases, is controlled in the US, in the US and the rest of the world. It's a lot of these things exist based on a subscription model where they need to make money to give access. So I think I see this question: is it acceptable for international publishers to only include open access articles? I would say I have rarely seen it framed that way, but it is very common to say at this step where we have screened in, we'll talk about this process in a bit, but where you search and then you do a quick screen of titles and abstracts to say, does this article meet my criteria or not? Quick. And then you come up with a list that you think, yes, I think all of these meet my criteria, but am I sure it meets my criteria? I need to see it in more detail. And at that phase, a lot of times it's very common for people to say, if we were not able to obtain the full text, that article had to be excluded. I would say that is not rare. And I've never heard of a journal editor or reviewer saying, this review is no good because they couldn't access these articles. So that's how I would frame it, rather than using open access articles only as a inclusion criteria to basically say we included all articles if we were able to get access to them. And again, we'll give you a few tips for how to try to be a little bit creative getting access. But if you can't get access, then you can't include them. That's all you can do. And that's unfortunately how the system is set up. As far as the databases, let me just say quickly, and then I'm happy to let you join in, that the databases, I would say if you can't use those databases because they're subscription based or they're too disorganized, you may just rely on something like PubMed, something that's publicly available for free, and say, well, that's the only place we did the search. And I think that's also very common. Even if it means you'll miss some articles, it's maybe the best you can do. Sorry, Dr. Zhang, was that you?
Yeah. To quick notes that the HMU library has some access to some full text database, and they would be happy to help to retrieve or to allow you to have access to that. Can you hear me okay? Hello?
Yes. Yeah, it's my headphones that are the problem. Yes, I can hear you. That's great. That's very helpful.
And the second comment is that to the authors, those who, when you can access to the full text, they would be very happy to share with you. Most would be happy to share, especially if they do a study that they trust in their quality and they want people to know about their studies. randomized control trial in particular. So write to them nicely. We will give it to you for free. Thank you.
Excellent. That's very important. It's great that you have that resource. That will make it a lot easier for you, because this is often a place where people run into barriers. So that's great. Thank you. Okay, I see the question. Can I quickly compare systematic reviews versus scoping reviews versus narrative reviews? Yeah, that's a great question. Just to give you a quick overview. So the key with a systematic review, as we've been saying, is that you're systematic. It's meant to be reproducible. You come up with that specific research question with your PICO defined, your inclusion and exclusion criteria clearly defined, and then you have a protocol and you execute that protocol exactly as written. And then someone else could take your same protocol that they can find in the report you wrote or on Prospero, and they could do the same thing with the same date parameters, the same search strategy, and they would get the same results. That's a systematic review, very rigorous and defined. A scoping, hopefully you can still hear me.
We can hear you.
You can. Okay, great. A scoping review is when you are essentially just searching. You're just looking. You're seeing. I want to see what's out there. It's sort of like an academic version of Googling it, right? You're saying, I'm interested in this topic. I want to see what I can find in the literature on that topic, and then you're describing it. So it's kind of the opposite of being systematic. A narrative review is somewhere in between. It's where what you're trying to do is specifically just narrate and describe what you found in the literature. So you're a bit systematic for how you search, but the goal of it is to just write up a narrative of describing what you found when you searched in the literature. You're not really looking to answer a specific research question. You're just describing what's in existence in the literature. So hopefully that's clear. Yeah. And then the last question here around better controlling heterogeneity in the criteria. I agree that systematic reviews often mention this as a limitation. To some extent, you can't get rid of heterogeneity because you will never find even 5 studies done on the same topic that were done exactly the same way. There will always be some change. But the more, when you're working on a topic where there has been a lot published, the more specific you can be when you think about the PICOs, the more homogeneity there will be, right? So if you're using the same specifically defined outcome and you're only looking at a certain kind of intervention and only a certain kind of study design on the same population, then those will be much more comparable studies that are much easier to kind of combine together, pool the results, talk about what you see, and say, by combining these, we've learned something new. We've sort of amplified the power we had to talk about this issue. But really, that's because you're using the same S, the same O, the same C, the same I, and the same P, right? And that's the way to do that. The reality is, many of you might be working on topics where if you use the same exact, very narrowly defined P, I, C, O, and S, you'll end up with 2 studies. And then are you actually learning anything new? Maybe. You could talk about the difference between those 2 studies, but that's probably not a very exciting systematic review. So you might need to kind of loosen things a little bit and say, okay, well, we'll look at different study designs, or we'll look at slightly different interventions, or we'll allow for 2 or 3 different types of outcomes. And then you have more to look at in your review. So I think the short answer is you can better control heterogeneity by being much more narrow in your definitions of the PICOS characteristics. And that can also create some challenges. But hopefully that helps answer your questions. All right, so speaking of PICOS, I'm going to hand it over to Sara to walk you through an exercise, because in our experience, we can talk about this all day, but until you actually sit down and try to think about it yourselves and try it, sometimes some of these things don't make sense. So we want to have you actually go ahead and try something, and I'll hand it over to.
Yeah, thank you. So I have put into the chat, no, I haven't. I will now put into the chat one more time our course website. And there is a worksheet that you can find halfway through day one. Here it's called Criteria Worksheet. When you open that up, you should, just make sure you all can see what I see. You should access this worksheet. There are also 4 articles. You can access them from the worksheet itself or from the course website. And the idea is that you go through each individual article and you just kind of look at what you can conclude with the inclusion criteria, and what you can find with the exclusion criteria was. And then if you have any questions, keeping track of those, we'll have a little bit of a discussion after we give you some time. And I will see, the link is not working.
Is it the link to the website, the course website overall, or is it the link to the worksheet that you're having trouble with? Oh, the worksheet. Okay. Let's see if we can, that's strange. Let's see if we can figure that out.
I can post it in the chat as well.
Great. Great. If you can just do that, that's great. So interesting. I wonder why that's happening though.
Okay, you should be able to download it from the chat as well. Let us know if you have any issues with that. But we'll take about 10 minutes and for you all to try and identify the inclusion and exclusion criteria, and again, keep track of any of your questions.
Okay, so I know that you all may not have, okay, hopefully you can hear me. Okay, good. I know you may not have all totally finished yet, but we want to make sure we have time for a little bit of talking about PICOs within your own groups. So we want to discuss, what did you all come up with and what questions do you have, having tried to think about the inclusion criteria for these studies? So for this first article on the list, go ahead and put in the chat what you think the inclusion criteria are for the study. This is the one, I'll put the link. Hold on, maybe I can just tell you. Sorry. The March 2023 article. And then drop in the chat. What do you think are some of the inclusion criteria? What did they decide gets included in the review? Right, exactly. Pediatric general surgery, all pediatric surgical subspecialties, pre, intra, or postoperative phases of care, definition of error, and error measurement method. Exactly. There you go. What about exclusion criteria? Which are the articles that they would not include? Should be able to find 4 of them, I think. Yep, absolutely. Okay, so I can see someone put publications that were duplicates or unrelated to humans were immediately excluded. That's definitely true, correct. And then beyond that, the other exclusion criteria, if the articles didn't have pediatric patients, then they were excluded. Here's an example of what we were just talking about before. If they couldn't find any full text, if we can't access the full text, we had to exclude it. If the full text was in a language other than English, we had to exclude it, or we did exclude it. We chose to exclude it. Very common that you'll see it restricted to English in that way. And then failure to define error. So if they didn't define the error that they're measuring in the study clear enough to be included, then we excluded it. So this is an example where they could have potentially contacted authors and said, did you define this more clearly? Let me understand it better. But in this case, they said if they didn't report it clearly, they didn't define it, we're not including it. And those are very reasonable and common decisions. So the reason we included this one as an example for the criteria practice is that this is a pretty easy example because they did a great job in reporting this and being very clear. These are the things that helped us include, and these are the things that made us exclude. You, as the reader, can find that very easily. And if you wanted to replicate what they had done, you would be able to do that very easily. You could follow these same inclusion and exclusion criteria. They don't make you guess what got included, right? And this is exactly what you're going for. How about, let's do the next one. How about the one by Zulfikar from 2023? What are the inclusion criteria? This one's also pretty clear. You should be able to find 4. Yes, exactly. I can see people found the section and have put it right in there. Right, only empirical peer-reviewed studies in journal publications, right? They made a decision. They also narrowed it to the last 10 years. They made a decision based on timing. Only English language. Now, I appreciate that in this one, they actually said, we understand that relying on English language studies may not represent all of the evidence, and it can create a language bias, but they looked at this and they basically said, we think that we've looked at so much and seen such consistent results that we don't think that this language bias would have changed our results. So at least they acknowledge that. I appreciate that. And then they're included only if they're related to international or overseas nurses as a specific cohort. Okay, and then what about exclusion? Somebody was ready. Perfect. I love it. I love it. So great. I won't read them all, but you can see. Now, some of these, to me, sometimes it's a little silly to say, okay, our inclusion criteria was studies were included only if they were in the English language. And our exclusion criteria is they were excluded if they were not in the English language. Well, okay, thank you. We get it. I don't really think it's necessary to include both the inclusion and the exclusion criteria as being the opposite of each other. But sometimes people feel like that's the way to be most clear. That's fine. Oftentimes it's what's the extra? stuff, like the first one and the sixth one. So we're only, we're excluding, I mean, I guess they did say they only included empirical studies, peer-reviewed studies, and journal publications. So therefore, you can assume that conference proceedings, general magazine articles, commentaries, opinion pieces, newsletters, or any other gray literature were excluded. I guess that's sort of the same, but they were very specific about that. And then the last one here is that opinion pieces or review studies were excluded from the final selection of studies. And that's actually quite important. You often want to make a decision whether you'll include other people's reviews. If someone else did a systematic review and they included a whole bunch of articles, are you including that and those articles, or are you only including them if you can find the source article? So those are all things that you want to think through. Okay, now the next one's a little tougher. Let's do the next one, which is the CSLIC article from 2020. What do you see as the inclusion criteria there? Yep, exactly. So there were three. The publication was defined as a systematic review or a meta-analysis, or as a review with a systematic search strategy, right? This is one where they only wanted to look at systematic reviews as opposed to excluding. They're only looking at application of VR as a computer-generated schemes, and has to be the presence of at least one psychophysiological factor. And then what, let me see what's in here. Yeah, this. And we'll talk tomorrow about what you do and how to deal with that.
Thank you, Sally and Sarah. So before we break for this morning, I just type in the two email, and I hope that the leaders of each group will send over your pre-call questions by early tomorrow morning, 7 a.m. our time, so that Ngọc and Minh Anh can forward to Sally and Sarah. And I would like to emphasize that this is a teamwork, not individual work. So please find your colleagues or your students who can work with you on your the question that you are interested in. So I expect the people question tomorrow. Thank you. Thank you all.
Thank you so much. We'll see you tomorrow.
Yeah. See you. Good night.
Thank
Good
you.
day.
Bye.
Bye bye.
Thank you. Bye.